Going in depth tonight, it's an industry we all depend on, but it's become more dangerous. Workplace violence and healthcare. The latest numbers show 2 nurses are assaulted every hour in the U.S. And just last week, a nurse practitioner was stabbed and killed by a patient in North Carolina. It's a reality for medical professionals, even here in the Upstate. But there is a new partnership to better track and enforce zero tolerance.
An important topic here. Fox County's Arthur Mondale explains what it is and why those on the front lines say it is so important. Arthur.
Justin and Tori, it comes down to retention at a time when frontline workers are still dealing with the pandemic. Here in South Carolina, there's new data tracking to reverse the trends and increase safety.
When I first started out as a young nurse, I did not worry about getting punched or kicked. Not to the same degree that I do now.
Lucy Easler has spent 27 years in nursing and says the healthcare environment across the board just isn't what it was.
It is not just a nursing phenomenon. It affects all disciplines, from the registration clerk to the patient navigator, to the food service worker.
Easler is also the chair of a system-wide council for workplace safety that Prisma Health launched in October 2019 to prevent workplace violence and aggression.
We're very concerned about the number of folks that we see leaving healthcare professions altogether because they feel reluctant to put themselves in harm's way.
We don't really have a full scope of how big this problem is, partly because we haven't built a structure around it. We haven't centralized reporting.
But now that centralized reporting does exist.
We've kind of built the body of water, and we got to keep leading our hospitals to it.
The South Carolina Hospital Association and Anthem Risk, a risk services company, have partnered to streamline actionable data, facilitate intervention, and create statewide safety improvement efforts.
I have not seen any other states that are trying to figure out how to track this on a statewide level so we can look at data, look at trends, and see what we can do to solve it.
It's just a very difficult situation, made more difficult by the climate.
According to Anthem Risk Vice President of Risk Management, Wendy Stevenson, emergency departments, labor and delivery, and behavioral health units are high-risk areas.
We've also had a lot of discussions with our hospitals about, this isn't part of the job. You do need to report them.
Stevenson says these efforts could lead to specific policy procedures or work practices around patients deemed more high risk.
We've gotten the reporting, but now we're seeing how big of an issue it really is.
Now, this message really drives home the point. The South Carolina Hospital Association says it's time for healthcare systems to look at workplace violence with the same intensity as surgical errors and infections. Arthur Mondale, Fox Carolina News.